My case study was about emergency department complications. In the early 1800s, there were no 1800s and 1900s. There were no emergency rooms. In 1970, Bruce Janek was the first emergency room trainee. Him and three other colleagues, they decided to open an emergency room in Alexandria, Virginia. Um, there was also another emergency room that was opened up in Pontiac, Michigan. A lot of problems, of course, arise during this time. With emergency rooms, you had challenges with acute care, overcrowding in the emergency rooms, things that they tried to work out in regards to organizational strengths and weaknesses. They could possibly, instead of registering at the front desk, they would register the patient at the bedside. Um, Prior to um, multiple emergency departments being open, you had different physicians working that were only specialized in that particular specialty. So therefore, they were unable to properly treat a lot of the patients because they only knew about their particular specialty. Um, During this time, they were able to well train staff to be multi tasking and also trained in multi specialty. Ways to decrease the overcrowding and the doctors only being familiar with one specialty that was training. They were making sure they were doing early discharging. If a patient presented in the hospital with a critical illness or injury, they went ahead and helped them, and either they were going to be discharged from the emergency room or they were discharged from the emergency room and admitted into the hospital. Um, a lot of people were going to the emergency rooms because it was open 24 hours, 7 days a week. You could pretty much get life saving treatment any time of the day. It was also a place where patients can be seen without having any insurance, because they felt as if they go to a regular physician's office that they would have to pay a copay before being seen. And of course, with recent technology and trainings, a lot of doctors are now well trained and able to handle any situation that arises in the emergency room.